Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be taking a look back into Chapter 4. We will be on page 88, and the textbook is called The Specialty Practice of Rehabilitation or Core Curriculum, the 8th edition. So, in quality improvement, better known as QI, this is a system that's going to look at how can we improve the processes. In healthcare, we are definitely looking on how can we improve or enhance care. And the father of quality improvement, whose name is Avidius Donbedian, in 1966 looked at how can we improve quality. And his article evaluating the quality of medical care came out and started to spur change. In 1980, Dr. Don Berwick decided to redesign healthcare into a system without errors. It says with waste, it says delay, and unsustainable costs. And his work and leadership led to the establishment of what we now know as the Institute for Healthcare Improvement, which is IHI. IHI is worldwide, and what they're always trying to do is sustain better outcomes and also enhance healthcare access. What we now know as modernized quality improvement is looking at how can we mitigate negative outcomes and how can we enhance positive outcomes. So let's look at positive outcomes, what we could consider as a positive outcome in healthcare. So we can consider better health engagement. Patients have a positive patient experience, and when they get the survey, they are saying the nurses on the night shift were excellent. They taught me about my medication. The nurses on the day shift taught me about wound treatment. And they're also saying that the medical team was there and they listened to them. They're also saying, well, the food was warm and it was tasty. Those can be considered positive outcomes. Negative outcomes can be considered as a complication or some happening that caused harm to a patient. For example, a patient has an indwelling urinary catheter. They get a catheter-associated urinary tract infection, better known as a CAUTI. That can be considered a negative outcome. A patient has a fall with injury. That could also be considered a negative outcome. As we stay on page 89, we're taking a look now at the Federal Agency for Healthcare Research and Quality, which is known as AHRQ. And what do? They provide healthcare organizations with multiple resources congruent with its charge to improve the quality and safety of our entire healthcare system. So when you go to the website for AHRQ, for example, they'll have many strategies to mitigate CAUTIs, CLAPSIs, pressure injuries, all of those quality indicators that really impact care. They have strategies to help nurses, physicians, anyone on the team to improve patient care. So the book suggests that there are various definitions about QI. And in this section, it talks about a set of researchers. I like this set of researchers and their definition possibly of what QI is. So it says Bataledin and Davidoff in 2012 suggest that QI is the combined and unceasing efforts of everyone. It says that healthcare professionals, patients and their families, researchers, payers, planners, and educators to make the changes that will lead to better patient outcomes, better system performance, and better professional development. So the writer of the book asserts that there are many different QI models, but we will focus on Plan, Do, Study, Act, which is better known as the PDSA model for QI. So under the P, when plan, it's looking to describe the objective, change being tested, predictions, needed action steps, and plan for collection of data. The D stands for do. You will run the test, describe what happens, and also collect data. For S, you will study, analyze the data, compare outcomes to predictions, and then summarize what you learned. And lastly, the A, you will act. You will decide what's next, make changes, and start another cycle. In summary, this week we looked at quality improvement. We looked at Avidius Donbedian as the father of quality improvement. We looked at Dr. Don Berwick's work at IHI. We looked at AHRQ and how they work as government leaders to mitigate negative patient outcomes and enhance positive patient outcomes. And lastly, we went over the Plan, Do, Study, Act model for QI. I'm encouraging you to continue on your CRRN examination journey, and we're thankful for your support and wish you well today. Take care. God bless.